I'm here with Patricia Cook, the medical director of the Daily Planet, a community health provider here in Richmond. And we have been talking about all of the impacts that the Trump administration has had on her ability to provide care. You faced a number of challenges this year. Can you just give us a high level overview of what you're facing?
So we're facing challenges with restrictions to our public funding from our grants, both from the state and the federal level. We're facing challenges with restrictions to public insurance programs like the ACA and Medicaid. About 60% of our patients have some form of public insurance and 40% don't. So we use the money that we make from serving those insured people to offset the care for people who don't have insurance. And in this situation, if we lose that 60-40 balance, it becomes more and more precarious.
And for the patients that could lose their health insurance, either because of the cuts to Medicaid or because they lose their tax credits under the ACA, what impact will being uninsured have on them?
So for patients, when you lose insurance, it means that you stop doing preventive care. So you stop your screenings for breast cancer, for colon cancer, for cervical cancer. You stop doing your chronic disease management, like you stop controlling your A1C if you're diabetic. You stop controlling your blood pressure because you give up those blood pressure medicines. And then you end up having a crisis. You end up having a heart attack. You have a stroke. You have an amputation, something that takes you to the hospital and puts the onus on the hospital at that point of doing uncompensated care for you. In a way that it's not efficient for anybody.
And it drives up costs for everybody else.
And it drives up costs for everybody else and limits access for everybody else.
And what does having many, many more uninsured patients coming into your doors do for the services you provide?
So we are a small business. We employ 150 people. We have to be able to pay our staff. And when we start to have more and more uncompensated care, that cuts into our bottom line. And as we start to shrink on the ability for us to provide services, then that at the same time, there's a growing number of people who are uninsured who do not have any other place to access it.
You know, our safety net providers are a critical component to our healthcare system across the country, and they are fraying to the breaking point. And if we do not reverse course and reverse these cuts to Medicaid, extend the enhanced premium tax credits under the ACA, and reverse the federal workforce and funding cuts, our healthcare safety net is just not going to be there for millions of Americans who need it.